What if there existed a form of cancer that was largely preventable and treatable if detected early? It does exist, and it's called cervical cancer. Cervical cancer is a malignant growth that starts in the cells of the cervix, the lower part of the uterus that connects to the vagina. This type of cancer develops very slowly, starting as a precancerous condition known as dysplasia. Dysplasia is easily detectable and is 100% treatable, preventing the development of full-blown cancer. So what causes cervical cancer? The most common cause is the human papillomavirus, also known as HPV. There are over 100 types of HPV, but only a few high-risk strains lead to cervical cancer. HPV is a sexually transmitted virus, and while condoms can reduce the risk, they do not eliminate it entirely. Risk factors for cervical cancer include having many sexual partners, early sexual activity, other sexually transmitted diseases, a weak immune system, and smoking. It's important to note that these risk factors increase the likelihood, but do not guarantee the development of cervical cancer. Prevention is the most powerful weapon against cervical cancer. Regular Pap smear tests can detect changes in the cervical cells before they turn into cancer. The HPV vaccine is also highly effective in preventing the types of HPV most often associated with cervical cancer. If cervical cancer does develop, there are several treatment options available. These include surgery, radiation therapy, and chemotherapy. The choice of treatment depends largely on the stage of the cancer. Early detection can lead to a high survival rate, emphasizing the importance of regular checkups. To summarize, cervical cancer is a type of cancer that begins in the cervix, often caused by high-risk strains of HPV. Risk factors include multiple sexual partners, early sexual activity, other STDs, a weak immune system, and smoking. Prevention methods include regular Pap smear tests and the HPV vaccine. If cervical cancer develops, treatment options include surgery, radiation therapy, and chemotherapy. The bottom line: regular checkups and preventative measures can be the difference between life and death when it comes to cervical cancer. Remain informed, stay vigilant, and always prioritize your health.